In today's video, we're talking about Clonidine or Catapres. And this is in response to a question that came up in my first live stream about alternative medications for benzodiazepines. Now, I already made the videos on propranolol and hydroxyzine, so make sure to check those out if you missed them. In today's video, we're discussing Clonidine or Catapres and its effectiveness in treating anxiety. So stay tuned. So what is Clonidine? Well, Clonidine is an alpha-2 adrenergic agonist. It's also a centrally acting alpha agonist that stimulates the alpha adrenergic receptors in the brainstem. And this actually helps reduce that sympathetic outflow or that fight or flight mechanism of the HPA axis where you're revved up. And that is often the case with anxiety. So this can actually help promote relaxation and reduce hyperactivity. It may also reduce that PTSD-driven fear response or hyperarousal response. It's also hypothesized that Clonidine can actually induce sleep by decreasing norepinephrine secretion with agonism of those alpha-2 adrenergic receptors, and this is seen as a negative feedback mechanism. It's also been shown in studies to reduce sleep latency, or the time that it takes you to fall asleep, and this has been seen in studies with children and adolescents with sleep problems. Now, Clonidine comes in tablet forms of extended release and immediate release, also in patches and even intravenous formulations. And so what is Clonidine used for? Well, Clonidine was FDA approved in 1974, and it's FDA approved for hypertension or high blood pressure and ADHD or attention deficit hyperactivity disorder, and this is the Clonidine extended release, also known as Cap-V, and this is for children ages 6 to 17 years old. Now, off-label uses include adult ADHD, Tourette's syndrome, substance withdrawal such as withdrawing from opiates and alcohol, as well as anxiety disorders like PTSD and social anxiety disorder, and even for menopausal flushing or those menopausal hot flashes. And so how long does Clonidine take to work? Well, in those therapeutic doses to help reduce anxiety, which is anywhere from 0.1 to 0.2 milligrams, is going to be 30 to 60 minutes, and then your anxiety should be reduced, blood pressure goes down, heart rate goes down, and you feel more relaxed. However, for the treatment of ADHD in children and that extended release formulation, it actually takes a couple of weeks before results are actually seen. And so is Clonidine addicting? Well, no, it's not addicting. But rebound symptoms can occur if you stop it abruptly. And when I say rebound symptoms, I'm talking about nervousness, agitation, headaches, tremor, and even a rebound hypertension where the blood pressure goes very high. And this can actually lead to a hypertensive crisis. And in rare instances, it has led to death. Now, if Clonidine is taken with a beta blocker for the treatment of blood pressure, it's important to taper off the beta blocker first for several days, then wait and taper off the Clonidine, because there's a more severe discontinuation rebound syndrome or reaction that occurs when a beta blocker is also present or being taken with Clonidine. And so what are those side effects of Clonidine? Well, the most common side effects that we're seeing at a rate of greater than 5% and at least twice of that of placebo are the following: somnolence, fatigue, upper respiratory tract infection symptoms like cough, runny nose, and sneezing. Irritability has been reported, throat pain or sore throat, insomnia, nightmares, emotional disorders, constipation, nasal congestion, increased body temperature, dry mouth, and even ear pain has been reported. Less common side effects include weakness, sexual dysfunction or impotence, depression, syncope or fainting, nervousness, agitation, tachycardia or increased heart rate, nausea, and vomiting. A couple of rare but dangerous side effects to take note of are sinus bradycardia or atrioventricular block or AV block. And this is where your heart rate goes way below 60 beats per minute, and in different degrees can actually stop the heart, where the most severe degree is like a 3rd degree heart block. And this should be monitored closely, especially if you're taking it for blood pressure, you're taking it in higher dosages, and you have a history of heart problems. And now another rare but dangerous side effect to be aware of is with drug withdrawal. So it has been noted during cases of drug withdrawal such as alcohol and opiate withdrawal, when using clonidine to help relieve those symptoms, a hypertensive encephalopathy has occurred, as well as a stroke and even death. So that needs to be monitored very closely. So if you're taking clonidine for that purpose, you should be doing it in a hospital or inpatient setting so you can be monitored closely. And so now, what are those drug interactions related to clonidine? Well, clonidine is actually metabolized by many CYP enzyme pathways, and it's also metabolized by 50% through the kidneys. And so there aren't really many interactions as far as drug inhibiting actions for clonidine. It's also not an inducer or an inhibitor of any of the enzymatic pathways as well. And so there aren't many drug interactions to report. However, you always want to do your drug interaction check just to be sure that your medications aren't being affected by clonidine or vice versa. Now, you do want to make sure to avoid or be cautious with the use of other central nervous system depressants like alcohol, as well as those barbiturates and benzodiazepines or any hypnotics or sedatives like sleep medications. Those will only increase the sedative effects and can even decrease your respiratory rate. You also want to be careful if you're combining clonidine with digitalis or digoxin, with calcium channel blockers, or even beta blockers, because if combined with clonidine, these can actually increase that risk of bradycardia and that AV block. So be careful there and make sure you're being monitored if you're on any of those combinations of medications. You also want to take caution with other blood pressure lowering medications, even including those antipsychotics. Remember that antipsychotics also reduce blood pressure, and so that can lead to more side effects of syncope or fainting, or even that orthostatic hypotension where you stand up and then your blood pressure drops and you may be at risk for falling at that time. And so now my final thoughts on clonidine. So clonidine is a relatively safe alternative to benzodiazepines, again used in short term, because as I mentioned before, skills before pills, right? So use those skills in therapy before pills if you can. However, if you need pills like clonidine, hydroxyzine, or propranolol, you can use them to help you in therapy so that you can build those skills. Then you use those skills to get off the pills. And also keep in mind that there are many side effects to clonidine, as I just went over. And so you're going to have to really weigh out the risk versus the benefits of taking this medication and discuss that with your mental health care provider. So there you have it. That's my overview on clonidine or Catapres. Do you have any experience with taking this medication? If so, drop it down in the comment section below, because we learn from sharing each other's experiences. And as always, I thank you for watching and wish you well on your mental health care journey, and look forward to seeing you all next time.